Hello, everybody. My name is Marina Vanderslice. I am a second-year Master of Athletic Training student here at the University of South Carolina. Today, I will be discussing a randomized control trial that evaluated the effectiveness of extracorporeal shockwave therapy versus ultrasound and deep friction massage therapies for lateral epicondylitis management. So, to get into the purpose of this study as well as the purpose of my presentation today, lateral epicondylitis is quite prevalent in racket sports such as tennis, as well as people just in their everyday life that require activities involving repetitive wrist extension. There have been countless treatment options for lateral epicondylitis, but there's not been much consensus on what the most effective option is, which leads us into the study that I will be discussing today. So to start off with some background, lateral epicondylitis is the inflammation or degeneration of the soft tissue structures attaching to the lateral epicondyle. It is commonly referred to as tennis elbow as well due to the prevalence of this injury in tennis players. Extracorporeal shockwave therapy is a therapeutic modality that is used to decrease pain, promote blood flow, and encourage tissue healing by sending shockwave therapies to an affected area. In this case, it would be the lateral epicondyle. Deep friction massage therapy is a technique used to break up adhesions and reduce inflammation in an area that has been injured. And ultrasound therapy is a therapeutic modality that is used to decrease pain and inflammation, promote tissue healing, increase tissue extensibility through non-thermal and thermal sound wave. So patient selection for this study, there were 74 participants in this study. They were male and female, and the ages ranged from 30 to 60 years old. So, diagnosis for lateral epicondylitis in this study was defined as localized pain over the lateral epicondyle for greater than 8 weeks and a positive Mills and Cosen's test. The exclusion criteria for this study included a history of trauma or surgery and prosthetics to the elbow, sensory deficits in the elbow, or a use of analgesics in the past 3 weeks, or corticosteroid injections. So for the shockwave group, there were 35 participants that completed the full study. The patients were positioned with their elbow propped up and flexed, as you can see in the picture that I took from the study here. And they received a shockwave therapy treatment that lasted about 5 minutes with the measurements listed there. And the ultrasound and deep friction massage group had 39 participants. They were positioned in the same way. They were given a deep friction massage across the common extensor tendon, as well as an ultrasound treatment that lasted 3 to 5 minutes. And they completed this 3 times per week for 7 weeks. So the outcome measures in this study were measured prior to their first treatment, at 3 weeks, and at 7 weeks. The numeric pain rating scale was used to get their baseline pain rating before any treatment was completed, and the patient-rated tennis elbow evaluation questionnaire, or the PRT, was used to evaluate their pain, their ability to complete special activities, as well as activities of daily living. So for the results, the baseline pain ratings prior to any treatment was a 6 or a 7 out of 10 on average, which is quite high. So definitely important to consider the most effective ways to manage this pain for our patients. Shockwave and ultrasound slash friction massage groups were showed to significantly improve the PRT scores at 3 weeks and 7 weeks. However, shockwave therapy was found to reduce the scores by greater amounts than the ultrasound group. So for some discussion on this, the results found that shockwave therapy was more effective in managing epicondylitis overall, and this is in agreement with a growing pool of evidence showing the effectiveness of shockwave therapy. However, there were some limitations to this study. It was a small sample size. There was an unequal distribution of participants in each group due to some patients dropping out throughout the process. They also discussed the numeric pain rating scale as not being able to show significant reductions in pain So if a patient rated their pain, say a 4 to begin with, but they felt that their pain had been reduced by greater than 4 points, the scale would not be able to measure that. And they also did not follow up with these participants long term to see if their pain relief and ability to complete their activities had remained the same. So the take-home message for this study is that extracorporeal shockwave therapy is more effective in reducing pain and improving ability to complete special and daily activities than ultrasound and deep friction massage therapies. These are my references. Thank you so much.